Dr. Badhwar is also with us now. Dr. Badhwar, we've been talking to you about the coronavirus. From what you understand, from all that you know, is the novel virus peaking now? In terms of the number of deaths being reported, in terms of the kind of scare. Have the number of cases or the situation stabilized in China? We're just trying to get a sense of it, given that every day we're hearing reports of it spreading. But has the situation really managed to be contained at all?
Greetings from Kokilaben. And you see, the first important thing is that the virus has got a new name. It's called the COVID-19. That's from the WHO. And the only reliable source of information is the data put out by the WHO. I agree there's been no fresh case yesterday, but on Monday, there were 100 new cases. So it's early days yet. And you have two sides of the story. You have a health expert from China saying that yes, the cases are going down. But on the other hand, you have a professor from Hong Kong, Professor Lung, who's saying that this is just the tip of the iceberg. So I would say, early days yet, hold your horses.
Sure. But just to understand, we've also heard from the WHO that a vaccine could be ready in as much as 18 months. Do we really have everything we need before, in advance of that to really fight it?
Yeah, you see, basically, as I mentioned earlier, the treatment is symptomatic and supportive care. A key factor in the development of a vaccine is the genome. So the genome is known, and if you've seen the recent reports, even the Indian Department of Biotech is at work, and the experts say we are 18 months away from a vaccine.
Okay, so in terms of the spread, Dr. Badhwar, just help us understand this. Are we still seeing an acceleration in the spread? And when it comes to the actual fatality, is that ebbing? We were looking at reports yesterday saying the mortality rate has been 1% against the kind of spread of the virus. Can you give us a sense of that?
You see, there's an index called the RO, the R naught. So as per that, every infected patient spreads the virus to 2 or 3 patients. So those are the ones we are looking at and one is worried about. You heard the concept of a super spreader, somebody who's been asymptomatic, who's developed the infection and managed to spread it to about 10 other patients. So we are worried about people who have traveled from the affected province, who've been in contact with people, and contact tracing has not been done. That's why it's the tip of the iceberg. Yes, there are two sides to the story. The SARS virus peaked in the winter months, but on the other hand, the MERS virus, which came out from Saudi Arabia, had an onset in the summer. So we still don't know the exact mode of spread, how is it going to spread out, and all the health authorities are closely watching it.
Talk about the spread. Do you think a lot of countries are now aware about this, and at least the spread in other countries ex China may be limited, or it's difficult to say that at this point of time?
See, I would refer you to the WHO risk assessment. So the WHO risk assessment for China is very high. Regional and global, it's high. So other countries have got their act together. There's screening which is happening at the airports. There are reports of airlines stopping the breathalyzer test to avoid spread, and people are undergoing either home quarantine or isolation in restricted areas. So people are aware, they're getting their act together, and as the chief of WHO said, you have to be extremely watchful. This could be the next public enemy number 1.
Wow. Okay. So I guess what we're trying to probe you for, Dr. Badhwar, is from a stock market point of view, the fears seem to be receding, but from a individual point of view, how concerned should one continue to be about the spread of the virus, particularly given that India so far has been relatively unaffected. But could we safely say the worst is behind us, or should we still continue to be alert?
I would say we need to be alert, early days yet, and compliments to the public health authorities in all the countries. And you could take a state like Kerala. After dealing with the Nipah virus, the Public Health Administration has got their act together. Contact screening is going on, quarantine procedures are going on, and measures are in play. So I would say we have to be alert, we have to be vigilant.
All right, Dr. Badhwar, thanks so much for joining us then and taking us through the latest on the virus.